I'm Dr. Steflik with Coastal Integrative Healthcare. I'm going to answer some questions we get today a lot about Kinesio tape. What is it and how does it work? You've probably seen it on a lot of professional athletes. Last night I was watching a basketball highlight. Paul George with the Indiana Pacers was wearing it. Maybe he's on the Pacers anymore, I don't know. But Paul George had it on his shoulder. I know James Harden has been wearing it on his shoulder a lot recently too. It's usually a black piece of tape that is covering an area or a part of the body. Kinesio tape first became popular back in the early 2000s with the beach volleyball. The beach volleyball girls that won the gold medal for the United States, one of them was wearing it and everybody started asking questions about it. We've been using it in our clinic for over 8 years and had phenomenal results with it. So what is it and how does it work? Kinesio tape is a piece of elastic tape, so that means it has some flexibility in the tape that supports the muscles and tendons that it covers, but it still allows for range of motion. With the testing and research that's been done with Kinesio tape, it's shown to decrease muscle fatigue and allow a faster response time with those that are wearing it. It can help prevent some further injury because your body is now being more aware of that area and it won't push it to the same limits as it does before. So how does it work? It's got a couple of different mechanisms and it depends on how it's applied to a particular part of the body. So if it's applied in a single strip, typically it's used as a supportive type taping. This can be done even for pregnant women who have a lot of back pain or pain in their belly from being pregnant. It can also be applied to shoulder pain with rotator cuff injuries or knee pain with arthritis. It's very common in athletes like runners who want to still have that full range, not feeling limitations, but get some relief. So that muscle support that it provides is very, very good. The other thing that it does is if it's applied in a different format, sometimes you'll see with like little fingers on the end where it kind of sprays out into little fine strips. These fine strips, when it's placed this way, will actually help lift the skin and it will decrease the inflammation. We've applied this tape on someone that's had a bruise, and when the tape was lifted, you could see exactly where the tape was. There was no bruising. It left a pattern, and you could see exactly where the tape was. The skin was white. It was free of any dark black or blue coloration, whereas the rest of it was not. So pretty amazing how it can lift the skin, help that healing process begin a whole lot sooner. So it depends on how it's applied. The third effect of Kinesio tape is that it actually has an effect on the nerves on top of the skin. If you bump your elbow, if you're walking down the hallway, chair, you bump your elbow into a chair really hard, what's the first thing that you want to do? You want to grab it and rub it because it makes it feel better. Just by putting some other stimulation onto the skin or in that area is going to make that pain go down. So Kinesio tape works the same way. Just by having something cover the skin on that area, it sends a different signal to the brain that allows the pain levels to come down. We've had patients use this tape that have had chronic pain for years and years in their heels, in their feet, knees, shoulders, neck, back, and the pain has gone away almost immediately. That doesn't happen with everybody, but the good thing about the tape is that the worst thing that could happen with Kinesio tape is nothing at all. So if nothing happens, great. I think we had one patient in the thousands and thousands that we've taped that had some skin irritation, and since then they've even changed the type of glue that they use on the tape, so that's very, very rare as well. The Kinesio tape is also great for patients that are in car accidents. If a patient's been involved in a car accident, one of the first things you want to do is help stabilize those muscles as best you can. When I was in a car accident 4 years ago, or 5 years ago, whatever it was, I was rear-ended pretty severely. And the first thing I did, I was headed home from work, I turned around, went back to work, hooked myself up to the muscle stim machine, and I got some Kinesio tape on my neck. That immediately helped with the pain that I was feeling and helped me recover faster from my rear end car accident collision. So it's very useful for conditions like whiplash. We also use it for a lot of our knee pain patients that are getting regenerative medicine in the office as well too. If you've heard about Kinesio tape or love Kinesio tape, leave a comment below how much you like it, why you like it. We'd love to hear from you and we'll talk to you soon.